One of the biochemistry tests that gave us more information about patient with medical emergency is the basic metabolic panel test. The basic metabolic panel test is done in the hospital setting to help analyze an individual metabolic activity, the acid and base balance within the person system. This test is a very unique routine test that many doctors do to understand how his or her patient body is functioning. So today we are going to take a very clear look at what the basic metabolic panel test is comprises of. Basic metabolic panel. Now the basic metabolic panel test is a blood test that measures 8 different chemical substances that occur naturally within the human blood. Now think of it that the entire human body is made of a chemical. Like we normally say that the human body is a container of chemical. In chemistry, you understand that the human body is comprised of natural elements that help carry on a whole lot of activities within the body. Therefore, there are 118 elements found on the periodic table. In all of these 118 elements, we have about 92 elements that occur naturally within the human body. All of these 92 elements, there are few of them that constitute 93% of the body weight. That is hydrogen, oxygen, nitrogen, carbon. These are elements that constitute 93% of the body mass. Despite of that, we also have other elements that are trace with 30% constitute 30% of mass within the human body. And these elements such as potassium, chloride, calcium, phosphorus, magnesium, these are elements that are traced within the human body and they are of great importance. So the basic metabolic panel is the most common routine test doctors order for their patients because it gives information about systems, about those important systems and organs. So the basic metabolic panel test is a very unique test that we need to understand and know what it is all about. And again, the basic metabolic panel test comprises of 8 different biochemicals that are evaluated within the human body. So let's look at some keywords before we continue in this lecture. Metabolism. I want us to get a very fundamental understanding about the BMP by getting a clear view about metabolism. So metabolism is a collective noun. It is chemical reaction in the human body that carry on the growth, repairing of damaged tissues. So when you look at metabolism, it is that kind of chemical reaction and physical processes that take place in the human body. An example of that we make mention here is the growth, which is growing. So you observe that cells has to divide and helps the human body to grow. So in that process, when cells are dividing, this give rise to tissues, and those tissues will give rise to an organ, and this organ will give rise to an organ system, and this organ system give rise to an organism. So it is metabolism, or during a metabolic process, or those chemical processes that occur in the body that helps the body to grow, that helps the body to repair those damaged tissues, that helps the body to react to those chemical substances in and out of the human body. So another thing is that another key word we need to look at is electrolytes. Now I just briefly talk about those natural elements that are found within the human body. We said there are 92 natural elements or elements that occur naturally, and we have constituted about 28 of them to be within the human body, occurring naturally in the human body. So example, we talk about calcium, which is a trace element, potassium, phosphorus, magnesium, bicarbonate. And now electrolytes are mineral. You see that conduct electricity when they are dissolved in water. For simple, they produces ions when they are immersed into a fluid, and these ions will conduct electricity. So elements that are involved in these activities, they are sodium, potassium, calcium, etc. These are electrolytes because they conduct electricity when they are dissolved in water. Another thing is homeostasis, the ability of the body to maintain relatively stable metabolism and to function normally despite the constant changes. So our body needs to regulate those activities that occur within it. That is the metabolism that occur within the human body, the waste products that are produced, the energies that are manufactured by the human body. So the body needs to be regulated in terms of growth. The body needs to be regulated in terms of response to stimulus and other activities. So therefore, homeostasis is very significant in this topic. The reason we are evaluating the basic metabolic panel in such a way is to give us understanding on how the human body have imbalances and balances, because homeostasis is actually concerned with those feedback mechanisms, that is the positive and negative feedback mechanism that helps the human body to get a unique balance. Take for example, if a person has a very low temperature and the environment is signaling that in fact this entire area is very cool, the human body will be stimulated and then release chemical substances that will activate those fatty acid within the adipose tissues to create heat within the system. So that's it. I want you to know about those key words. So what is BMP used for? Now the basic metabolic panel is used to check different body function processes that include the kidney function, the fluid and electrolyte balance, that is those minerals that form within the human body that keep it functioning. They has to be at a balanced rate. So if they are not balanced, then that means there is a bit of malfunction within the human body. So in most cases, in most emergency cases such as shock, or unconsciousness, semi-consciousness, these are cases that are usually involve routine tests of BMP to have a clear information about how the person's body is functioning at the moment before having a problem focused examination. A blood sugar level. So another thing is the blood sugar level. If the blood sugar level is high, you observe that the person will have some level of malfunctions. That is, the person or pressure will go up. The person might go into coma. The person will have a lot of signs and symptoms, neuropathic activities that will occur. So, and last one is metabolic, right? So, okay, so that is it. Basic metabolic panel is actually used for checking the kidney function, the fluid and electrolyte balance, blood sugar level, and metabolism. So what does the BMP test measure? What are those things that the BMP test measure? Previously, I said that the BMP measure 8 distinct biochemicals in the human body. And what are those 8 distinct biochemicals that are in the human body? 1 is glucose, 2 calcium, 3 sodium, 4 potassium, 5 bicarbonate, 6 chloride, 7 the blood urea nitrogen, 9 which is creatinine. So glucose is 1, calcium is 2, sodium is 3, potassium is 4, bicarbonate is 5, chloride is 6, blood urea nitrogen is 7, and creatinine is 8. Now we are going to take a very clear view at each of them. Glucose, that's good. Glucose is also known as a blood sugar. So glucose is just a common way of referring to the sugar found within the human blood, and this kind of sugar is actually important for the human body because as it serves as a source of energy for the entire human body. So it is glucose that the cell take in and carry on cellular respiration, that which we have our glycolysis. From glycolysis we have the citric acid cycle, and from citric acid cycle we have the phospholytic oxidation state. So all these processes that produce energy for the human body, they make use of what we call glucose. Glucose is that kind of a compound that has a 6 carbon molecules, and these 6 carbon molecules are broken and goes into two pathways to produce energy. That is very good. So in this clinical understanding, we actually do a person blood sugar test to know or assess for two important things. That is one, we want to assess whether this glucose in the person's blood is high. So if the glucose in the person's blood is very high, that terminology, medical terminology for that is hyperglycemia. Now hyperglycemia is a condition, is that a name that refers to high blood glucose, glucose, which is high blood sugar level, and this will account for sickness called diabetes. Then another thing, we look at hypoglycemia, that is a big way to say low blood sugar. So hypoglycemia is very dangerous also, because hypoglycemia, if there is no glucose supply or energy supplies to the brain, the human brain, that person might lose his or her level of consciousness, and that person might have some psychiatric a problem, because the brain need glucose to function properly. So calcium is the next one, and calcium is a mineral that is essential for the bone and muscle growth. So what do we order calcium within the BMP test? Calcium is ordered to analyze one, the activities of the muscle contraction, muscle activity, because that is all for the metabolic zinc. To know how healthy that person bone is, that falls on the metabolic zinc. So a calcium test is done to assess for what we call hypercalcemia. Now hypercalcemia will refer bone diseases, thyroid diseases, and that of kidney diseases. So hypercalcemia is the big way to say that the person has a very high level of calcium within their blood. Then hypocalcemia is to say that the person has a very low amount of calcium within his or her blood, and this will result into vitamin D deficiencies and the parathyroid diseases. So calcium is very important, because once we notice that the calcium is high, our attention runs to hypercalcemia, which will account for diseases like a thyroid disease or kidney disease. Then you can now start to focus your attention to resolving the issue of the high or hypercalcemia within the blood. So the next one is sodium. So now sodium is another mineral, as I said, that when dissolved in water, they conduct electricity. So sodium is an electrolyte that played an important role in maintaining proper fluid balance. That is the blood, what we call the blood specific gravity. We want to know or maintain the level of blood and the level of fluid content that is within the human body, that it should be maintained. So the maintenance, as I said previously, the maintenance of the body and an equilibrium has to do with homeostasis. So sodium is a mineral that participates in that, helping the body to be maintained, which is the fluid in the human body to be maintained at a balanced level, and also function, helps the muscles contractions, and it helps nerves that are within the human body to power those nerves to communicate properly within the human body. and they also help in the acid-base balance with the human body. So the reason we are doing a sodium test within the BMP is to assess for what we call hypernatremia and hyponatremia. And hypernatremia means it has a high level of sodium within the blood, and hyponatremia means you have a low level of sodium within the blood. And most of these most of the metabolic activity is actually in line with the endocrine system, because the endocrine system is actually there to release whole chemicals and maintain growth, development, and those balances within the human body. So the endocrine system will release chemical substances that must stimulate these things, these electrolytes within the human body, and there are some conditions that will also cause them to decrease within the human body. So the next one is potassium. Potassium is a third most abundant mineral in the body. So it helps regulate the fluid and nerves signaling, like I just said previously. So because of their ability to conduct electricity, they also have a very cardinal function and to help carry on what we call nerves connectivity, sending impulses from one side to another side. So it is these elements that help to do that. So if in a medical emergency a person is unconscious, then definitely there must be a serious problem with one of these tests. That is, either the person has a low fluid content, and the reason that the person has a low fluid content is because, wow, maybe the person potassium level is low, or the potassium level is high, or the sodium level is low, or the sodium level is high. So potassium we assess for what we call hyperkalemia. Now hyperkalemia which is increased level of potassium. This occurs when there is a kidney disease or when there is a complicated diabetic dehydration, because diabetes is a very bad sickness. And when we are discussing diabetes, you will understand that diabetes has to do with there are two types, major classification. That is one. We have what we call the dependence diabetes and independent diabetes. So the next thing is hypokalemia, which is this account for whenever you are seeing that a person has a very low level of potassium, which is very much important for the muscles regulation and contraction, most especially the contraction of the heart muscles. So in this case, hypokalemia will account for chronic kidney disease, which is CKD, and alcohol use and disorder. That is, people who drink alcohol excessively come down with alcoholism, and people that take in diuretics or medicine, and people that have excessive level of sweating, and people that have an eating disorder called bulimia nervosa. That is vomiting much, and once you are vomiting much, you will lose fluid content will form in the body. So we have bicarbonate, and bicarbonate is a very important a very important component of the BMP, which is basic metabolic panel. The bicarbonate is an electrolyte that helps to measure carbon dioxide level in the blood. Now, the human body takes in oxygen and remove what we call CO2, and it accepts for acid base, which is the pH balance and the electrolyte balance. That is, if there is a high level or a low level of bicarbonate within the human body, this will indicate what we call that takes, for example, there is a high level, right? A high level of bicarbonate. This will indicate a condition called alkalosis. Now, metabolic alkalosis is wherein the pH of the individual body increase, and metabolic acidosis is where the acid content of the person will increase. Then we have chloride. Chloride works with potassium, sodium, and bicarbonate to facilitate proper water, electrolyte, and acid-base balance status in the human body. So that's not much. We look at the hyperchloremia, that it will account for kidney disease, eating too much salt. And one of the key things is that people with high level of chloride, or people that eat high level of salt in their diet, they usually comes down with hypertension. So this is one of the reasons why the basic metabolic test is all routinely, because if a person who has hypertension have a medical emergency, and when they do this test and observe that the chloride level is high, then that means the person is a hypertension patient that do not need to take in fluid that contain salt or chloride. So hypochloremia, if there is a low level of what we call chloride in the human body, there will be heart failure, the inability of the heart to pump properly. Then the blood urea nitrogen. This is a very unique test that measures the amount of urea nitrogen formed in the blood. This assesses for the health of the kidney, and this blood urea nitrogen is produced from metabolic activity within the liver. So definitely the liver is the detoxifier. So if there is a high level of BUN formed within the blood, within the urine in the person blood, this indicates that the person kidney is having a high level of problem, because this blood urea nitrogen should not be within the human blood. So the last year is creatinine. Creatinine is a waste material generated by normal muscle activities. So all of the muscle activity, whether contraction, whether you are contracting or you are releasing your muscles, all muscular activity, waste product or the byproduct of all muscular activity is a product called creatinine. So creatinine is something that the kidney should not reabsorb. It is something that should not be high within the human body. So if there is a high level of creatinine in the human body, then that means this person will have a serious kidney problem. So lastly, let's look at the laboratory value of the basic metabolic panel test. So when you look at the laboratory analysis on the string, you will observe that we have the A test, that is the glucose, the calcium, the glucose, calcium, sodium, potassium, bicarbonate, chloride, the BUN, which is blood urea nitrogen, the creatinine. So these are tests that comprises of the BMP, which include the 8 tests make up the BMP. Now let's look at the normal value of glucose that we need to have a clear understanding of within the human blood. Glucose should be between around 70 to 110 milligram or 100 milliliter. So increased level of glucose will account for, which is hyperglycemia, will account for diabetic mellitus, liver diseases such as cirrhosis and other chronic liver infections, and it will also account for hyperthyroidism, because hyperthyroidism is a gland, or hyperthyroid glands, or the thyroid gland is a gland that is formed within the endocrine system that release hormones that help regulate the human body. So calcium should be around the normal range of calcium should be around 4.3 to 5.3, or that is macro equivalent per liter. And high level of calcium, which will account for diseases such as hyperparathyroidism. So hyperparathyroidism diseases, it will account for that when there's a high level of calcium. And high level of, decreased level, you have hypothyroidism, is hypoparathyroidism, and it will account for all severe diarrhea and malnutrition. So sodium should be around 136 to 142 macro equivalent per liter. That is when sodium increase. The clinical significance is that when sodium increase, that means the individual has severe level of dehydration. And when sodium decrease, that means the individual has kidney disease, diarrhea, or severe burn. And in most cases, calcium, sodium, potassium, chloride, they are cases that you need to in case of burns, you actually, as a medical practitioner, need to rehydrate the person with the various fluids, because at that time the patient will be losing a whole lot of calcium, sodium, potassium, and chloride within from the skin, right? So another thing, because you know that the skin serves as a barrier to protect the loss of water from the human body. So if there is any disorder or there is a burn, then that means that's a very serious issue. So potassium should be from 3.5 to that of 5.0 macro equivalent per liter. That is, if the clinical significance is that when potassium increase, there will be a severe cellular destruction in the human body, because we said that potassium helps to coordinate nerves signaling, and that of muscles contraction. So if there is a decreased amount, we will also observe that the person had a diarrhea or kidney disease. So bicarbonate should be around 23 to 29 macro equivalent per liter. Increase, as I talk about that, increased level of bicarbonate, the clinical significance is that it will cause what we call metabolic alkalosis, and when it decreases is metabolic acidosis. So chloride will constitute 95 to 108 macro equivalent in a laboratory result. So if there is a decreased level of chloride, that means there is a severe diarrhea, burn, and ketoacidosis. So we have the blood urea nitrogen should be around 8 to 25 milligram per 100 milliliter or per 100 milliliter, right? So increased level of BUN account for kidney disease and high protein. So creatinine in the last one is 0.6 to 1.5 milligram per 100 milliliter. Increase, there will be a kidney disease. So that is all for the basic metabolic panel test or biochemistry test that evaluate a person's metabolic activity, the acid-base balance within the human body, and also examine those various important systems and organs. That includes the kidney, the human heart, and that of the endocrine system, which helps to regulate the human body. So thank you for watching this video and keep following our channel. Thank you so much.